everyone. I am Lourdes Jane Hordista Renoblas, a Level 1 nursing student from the University of the Visayas. And in this video, I will be performing my return demonstration for administering intramuscular injection. Medication is a substance administered for the diagnosis, cure, treatment, relief of a symptom, or for the prevention of disease. Intramuscular injection is an injection administered into the muscle tissue. The purpose and significance of administering intramuscular injection is to provide a medication the client requires. Perform hand hygiene. This is done to prevent the transmission of harmful pathogens during the administration of healthcare. Next is to prepare medication vial for drug withdrawal, which I did earlier on a separate return demonstration video. This is done to save time and effort and to carry out tasks in a systematic manner. Next is to provide for client privacy. If you are in a ward, be sure to place curtain drapes around the working area, or if you are in a private room, be sure that the doors are closed and adjust curtains if there are any. Providing privacy is the client's basic right. Through this, we can establish rapport and promote client's comfort and participation. Next is to introduce yourself to the client and verify the client's identity. Mayong adlaw, ma'am. Ako day si Jane, imong student nurse. Pwede ko mangutana, unsa ganito'y pangalan nimo, ma'am?
Solal Riego.
Okay, Ma'am Solel, salamat. This is done to ensure that we are carrying out the correct procedure with the correct client. Next is to assist the client to a position depending on the chosen site. For vastus lateralis, lie flat or supine with knees slightly flexed. For ventrogluteal, lie on side or back with knee and hips slightly flexed. For dorsogluteal, lie prone with feet turned inward or on side with upper knee and hip flexed and placed in front of the lower leg. This will allow the nurse to access the appropriate site for intramuscular injection. Next is to explain the purpose of the medication and why it is important. Ang bakuna, Ma'am Solel, makaprotekta nato batok sa makadaot nga mga sakit. Nakasabot ra ba, ma'am?
Makasabot ra.
Salamat, Ma'am Solel. Providing information to your client will minimize anxiety and fear, will foster trust, and will promote client cooperation. Next is to select a site free of skin lesions, tenderness, swelling, or localized inflammation, and one that has not been frequently used. Ma'am, ahong isa ka ang bukton sa imong sanina, ma'am, ha? Nodules or lumps may indicate a previous injection site where absorption was inadequate. Next is to locate the exact site for injection. Site identification decreases the risk of injury. Good visualization is necessary to establish the correct location of the site and to avoid damage to tissues. Next is to put on clean gloves. But since I don't have clean gloves, I will use sterile gloves instead. Gloves protects both the nurse and the client from possible transmission of microorganisms. Next is to clean the site with an antiseptic swab. Use a circular motion starting at the center and move upward about 5 centimeters or 2 inches and allow the skin to dry. Pathogens are removed from the injection site using this method. Next is to remove the needle cover and discard without contaminating the needle. This technique lessens the risk of accidental needle stick and also prevents inadvertently unscrewing the bevel from the barrel of the syringe. And use the ulnar side of the non-dominant hand to pull the skin approximately 1 inch to the side. Pulling the skin is advised for thinner patients in order to lift the adipose tissue up and away from the underlying muscle and tissue. Next is to hold the syringe between the thumb and forefinger of dominant hand. This position keeps my fingers off the plunger, preventing accidental medication loss while inserting the needle. Inject quickly and firmly at a 90-degree angle and insert the needle into the muscle. A quick insertion is less painful. This angle ensures me that the needle will enter the muscle tissue. But since I will not be able to inject the medication directly into the client's arm, without the supervision of a registered nurse, I will instead use a tomato. So, next is to release the skin. Releasing the skin when the needle is inserted is done to avoid injecting into compressed tissue. Hold the barrel of the syringe steady with non-dominant hand and aspirate by pulling back on the plunger with your dominant hand and aspirate for 5 to 10 seconds. A serious reaction may occur if a drug intended for intramuscular use is injected into a vein. Then slowly inject the medication. Rapid injection of medication can lead to speed shock. Next is to quickly withdraw the needle at the angle at which it was inserted and apply a dry sponge. Slow needle withdrawal may be uncomfortable to the patient. Next is to assist the client to a comfortable position to provide client's comfort. Ma'am, lingkod lang ma'am. Okay ka ma'am, wala na ning haway mong arm ma'am. Okay ra ka?
Wala. Okay ra.
Next is to discard the uncapped needle and syringe in a safe receptacle. Proper disposal prevents injury. Most accidental needle sticks occur while recapping needles. Next is to remove gloves and wash your hands. And lastly, document all relevant information.